I'm Michael Barasch, and I'm so thrilled to host this webinar for Pentagon responders. I want everyone to understand that you have the same benefits available to you as the New York City firefighters and cops. You were exposed to jet fuel, concrete dust, carcinogens, which are now causing and have been linked to 68 cancers. Lori Zamzel is with us today. Lori, say hi to everybody and tell us briefly a little bit about yourself.
Thank you, Michael. My name is Lori Zamzel. On 9/11, I was working as a 911 dispatcher for Fairfax County Police and Fire Department. I was sent out to the Pentagon in the command unit. We were parked on the helipad for that night. I am really thrilled to be part of this today because I think it's important to reach out and make sure that we find dispatchers, other people who wouldn't maybe necessarily consider themselves part of or benefiting from this program. It's been 20 years. A lot of us, try as hard as we can not to remember that day. As dispatchers, we're typically, heard but not seen. But I just want to encourage everybody to take advantage of the program. You're going to hear a lot in the next hour about what the benefits are. It's not complicated, but it's not easy. I've been through the process myself. I'm nearly completed. It is just important to do it sooner rather than later. It's a methodical, slow process. You'll hear Mr. Barasch say you don't need a lawyer for it, but it was the final step that encouraged me to do it because I just felt like my life's too crazy. I'm not sick right now. Why am I going to take this on when I have 100 other things I'm trying to get done in my life? But it's important because you want to be past all these initial steps, God forbid if anything ever happens. So I want to encourage you, be your own advocate. It will, like I said, it's a bit methodical. You'll have to advocate for yourself at times, but the benefits of this program are worthwhile.
Well, Lori, thank you. I'm going to get back to you in a little while. With us also today, my partners, Dana Cohen, Dom Penson, and Lee London. Deputy Chief or FDNY Deputy Chief retired, Richie Allies. Richie, thanks for making some time to come in today and talk to us.
You're welcome, Michael. It's a pleasure to be here.
Yeah, now, Richie, while you certainly had your exposure at the World Trade Center, the theme of our meeting today is to make sure that the Pentagon responders know that they are entitled to the same healthcare, free healthcare, nationwide, and Victim Compensation Fund compensation. And we are very fortunate today to have Liam Lynch of NICOSH join us. Liam's going to talk about the World Trade Center Health Program, which I'm just going to say right off the top is a terrible name because it also is available to those of you who are Pentagon responders. And also, finally, my associate, James Steiner. Having said that, let's go right into it.
The first responders, I'm in awe. It's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents 20,000 people in the 9/11 community. Every single day, we hear from more and more survivors because we're doing this outreach. You need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of 9/11 toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you. So let's get right into what will now be the first slide. Lee, would you please take us through the exposure hours that are required in order to be eligible for both the health program and the Victim Compensation Fund?
Sure, and I just wanted to thank everybody for joining us today. Just like Michael said, I am trying to encourage every Pentagon first responder and survivor to register for the Victim Compensation Fund and the World Trade Center Health Program, even if you're healthy. We want to make sure you're protected, that you know about these benefits. But going into exact exposure for Pentagon first responders, the exposure period starts from 9/11/2001 to November 19th of 2001. And all you need is 4 hours of exposure during that time period. The World Trade Center Health Program is an unbelievable program, and first responders can join it if they're sick or not. Survivors, such as students, teachers that work below Canal Street in New York City that qualify, they have to be sick to join the health program. First responders do not have to be sick to join the health program. There are amazing benefits, and these benefits don't impact any other benefits that you currently have from the VA or anything such as that. So that's why we're encouraging everybody to join. And then you'll see something here that says overall less than 5% of the Pentagon community has applied to the health program. So in total, out of every single person, survivor, first responder from the Pentagon to New York City to the morgue, there are 110,000 people in the World Trade Center Health Program. There are only 989 Pentagon responders in the health program. The response to the Pentagon was over 10,000 people, and there's only 989 in the program. That is over 9,000 people that don't know about it, don't know that they qualify for it. So that's why we are getting the word out to any family members, anybody that was there. We want them to know that they will qualify for the health program and the Victim Compensation Fund.
You know, Lee, you mentioned, and first of all, I guess that slide needs to be updated because it's probably a little less than 10% of the Pentagon community has applied. But think about it. Why should Pentagon responders think that they're eligible for the health program when it's called the World Trade Center Health Program? That's why I'm so offended by that name, and I wish they would change it. But I so appreciate all of you tuning in today, and hopefully you'll help us spread the word to your fellow responders, even if they are retired. And Lee, you mentioned something else. If I can ask you to follow up on something, you said we're encouraging people to sign up even if they're healthy. Why should they sign up if they're healthy?
Because we want them in these programs today and now. I get calls all the time from Pentagon first responders saying, all I have is asthma, just something small. What's the point of me registering now? The point is that number one, you're with other people in the 9/11 community that are suffering from the same things that you're suffering from. I've been doing this for over 8 years. If I get a call from someone in 2016, they have light asthma. By 2019, they could have been diagnosed with a severe cancer condition, and they're killing themselves that they didn't start this process when all they had was asthma, because then it is a smooth process. We want people getting in when they just have the minor conditions. So God forbid something comes in the future, we can add it to their claim and everything's already taken care of. Another reason why we want people to move forward today, even if they're healthy, is because you have to secure your proof of presence documentation. Many people are passing away in the 9/11 community that you would call on to say, yes, I worked with Jimmy in the zone during that time. You know, we want to make sure you secure it today because unfortunately, people are passing away and it comes out of nowhere. And it's really important to be in the program, not only for the numbers and statistics to add new conditions that once were not covered, as cancer wasn't even covered under the program until 2013, but also so you are around other people that have this exposure, so they have the data and that you have the benefits that are available to you.
Right. I mean, I will tell you this, it's crazy, but so many people have told all of us that, oh, I only had basal cell cancer, not realizing that's cancer. And as you'll see from a slide in a minute, that's worth $90,000. Plus you get free health care for all your deductibles and copays for insurance, whatever insurance doesn't pay. So it makes sense, even if you're in remission, because God forbid you go out of remission or you get a new cancer, you don't want to start the process then. So let's get to the health program. First of all, Liam, would you introduce yourself and tell us a little bit about your organization?
Guys, thank you so much for having me here. So my name is Liam with NICOSH, New York Committee for Occupational Safety and Health, and we're a nonprofit in the New York area that was here, after 9/11. We had industrial hygienists testing the air, and we were working with the community to advocate for the passage of the Zadroga Act, which ultimately was passed and was reauthorized. And on that note, we have deadlines for the VCF going on right now, but we do not have deadlines for the World Trade Center Health Program. And this, for responders is, provides health screenings, treatment for those who were directly affected by 9/11, not only in New York, but in the Pentagon and Shanksville, Pennsylvania, right? And the program is extremely unique. I can talk a lot about it, but the short version here is that these are physicians and healthcare professionals who are specialized in treating 9/11 responders, who understand the unique circumstances of the conditions and the experience and really caring for this population. And that experience and that specialization really makes this program stand out and is worth, the resources and time to enroll alone. And also, we know that responders are really caring people, that they care for others before they think of themselves. And if responders, if you opt in as a patient in the program, your patient data can be used for extremely valuable research to help us care for responders and survivors in future disasters, but this one too, because this program is not static. It evolves and is designed to evolve with the changing needs of its patients. So the more data they have more information and can add conditions. There are over 100 different conditions right now that are related to exposure from 9/11. You've got, 68 different cancers, a whole bunch of aerodigestive disorders. Mental health conditions are covered too, such as PTSD. And more can be added, the more data that accumulates over time. When I first started working in this field, the program was not covering cancer. And treatment for these certified 9/11 health-related conditions are all the way from medical tests, doctor visits, surgeries, prescription drugs, and there's a pretty robust benefit counseling program. This is a national program, so it's not just in the New York metro area. You can receive care nationwide in all 50 states, including Puerto Rico, and that's happening right now. And I just want to end with, we're 20 years out, and a lot of people want to bury this history, and we know that it's still very much alive with us today. And there's a long latency period between the time of exposure to the time of developing a condition. And we know that there was asbestos in these buildings that 9/11 responders were exposed to, and you could be exposed to asbestos today and not see a condition 20, 30, 40 years later. And early detection saves lives. And so we really want people to be in the program, even if they're not sick, to get that annual exam. So, Michael, I'll leave that here, but always here for follow-up questions.
Hey, Chief Allies, would you please tell us, you're in the health program, aren't you?
Yes, I am. Yes, I am. So I was diagnosed with skin cancer in 2010. Fortunately, skin cancer is usually not a life-threatening condition. It can be. Unfortunately, the health program doesn't have the resources to screen for it because it'd be too expensive and costly to have a dermatologist on staff at all of these facilities. But the Victim Compensation Fund compensates for it. Anyway, all of us should then use our private insurance and get a dermatology exam. In my case, just coincidentally, a World Trade Center Health Program doctor happened to notice something on my neck, which I hadn't been aware of, and I'm shaving every day, and it just didn't like it and advised me to go to a dermatologist, which I did. Turned out to be skin cancer. I had another colleague of mine, and just to show you that, we kind of always thought, oh, it's sun exposure. No, the exposure to many of these toxins, both at the World Trade Center and also at the Pentagon, the pH of these toxins is the same as Drano. So the fine particles get in your body and create havoc. We had a colleague of mine who was a client of ours, but a year ago had a rash on his arm, went to the dermatologist. Everything checked out, including the rash on his arm, was nothing to be concerned about. But the doctor noticed a slight discoloration on one of his fingernails. Went in, did a biopsy. The biopsy came back. Not only was it skin cancer, it was melanoma, the most aggressive form of skin cancer. And they had to cut off the tip of his finger. He had to undergo some chemo because those cancer cells can get into your lymph nodes and break out in another part of the body. But the good part of the story is that he's a survivor and in great shape and has no other medical conditions. But had he not gone to a dermatologist, that easily could be a different story that I would be telling.
Yeah, I can't tell you. I mean, I just was reminded our partner Sarah spoke to someone this week who said, "Oh, I don't have anything, just melanoma." Well, melanoma can be life-threatening, and it's worth $250,000. But again, you don't do it for the money; you do it for the free health care. Richie, didn't you tell me a story about someone had told you that due to their particular cancer, their chemotherapy drugs are costing $20,000 a month? And thank God for the health program because it picks up every nickel. I urge everybody, there's no downside to joining the health program. And by the way, as you're going to learn in a second, the law requires that the health program certifies your illness in order for the Victim Compensation Fund to then award you compensation. Hello there, Lee. Would you take us through these presumed 9/11 illnesses? And first tell everybody what the word presumed means and how important that is with regard to the Victim Compensation Fund.
Sure. So the word presumed always comes in when I speak to a Pentagon responder where he goes, "Oh, I have a family history of prostate cancer. How do I know it's covered?" If you were in the zone, if you qualify for the 4 hours at the Pentagon from 9/11, 2001 to November 19th of 2001, and you have the 4 hours, it is presumed your cancer is linked to your exposure at the Pentagon. So you do not have to dismiss it. If your private doctor says, "I don't know if this is covered," it's probably not covered. It is presumed. There are certain latency requirements for certain solid cancers, blood cancers, and so forth. That's why if you have a question, please call us. Please ask somebody. I always encourage people to ask questions. Is this condition covered? Is this not covered? You have to ask. But if you were in the zone at the Pentagon and you come down with a horrible cancer, it is a presumption that it was linked to your exposure from 9/11. We don't have to prove it with doctors or anything like that. But also, you never waive your future right. So if you move forward on, let's say, skin cancer, and I bring up skin cancer, not only is it the largest organ on the body, but it is taking this long to develop. I'll sign up Pentagon responders from 2016. I'm getting calls from them in 2020 saying, "I got, a little basal cell, squamous cell, melanoma. You have to let us know." And these are all conditions that we can make amendments for you on for the Victim Compensation Fund and move forward on a claim for you based on. So it is so important to go to your dermatologist, get a full body skin check, but also to be a part of the health program, because I don't want you listening to your private doctors or your family history or the fact that you used to smoke cigarettes. It doesn't matter. It's presumed that if you were in the zone, it's like lighting a match on top of fire. It caused it. It's presuming. Now, look, there are certain cancers that have to be diagnosed. Solid cancers have to be diagnosed after September of 2005. Blood cancers have to be diagnosed 146 days after your exposure. So there are latency requirements. But if you were there in the zone during that time, it's covered. Now, this isn't just the cancer fund. I want to make sure people understand that. There are 68 cancers covered, but there is a host of respiratory and other severe conditions that many people suffer from interstitial lung disease to sarcoidosis, to GERD, to asthma, to obstructive sleep apnea. It is ridiculous what you can suffer from, what it starts at, and what it can evolve into. So you want to make sure you're protected. You want to make sure your family's protected, but you also want to ask questions. And the only way you can get new conditions added is if the health program has the data from Pentagon responders and so forth, so they can add new conditions. So it is so important, but take a look at this list and please call us with any questions.
And again, this list only has 10 cancers. There are 68 cancers, so it's almost every cancer you can think of. Dom, Lee mentioned something about latency. Can you just, in a Reader's Digest version, tell us
Sure.
what do you mean by a latency period?
Latency period refers to the minimum amount of time that must pass between your exposure and the onset of symptoms of your World Trade Center illness. So when, for example, Lee talked about 146 days for certain blood cancers, what he meant was that the onset of symptoms cannot have occurred before 146 days from your exposure. They have to have occurred at least 146 days after your exposure. And with what Lee referred to as solid cancers, meaning cancers of the organs, such as the skin, the prostate, the brain, the onset of symptoms, in order for the presumption to exist, cannot have been before September 11, 2005. But if your cancer symptoms came on after September 11, 2005 for one of these so-called solid cancers, then the presumption applies. And the health program says it's linked to your exposure.
Right. So again, your own personal doctor just may not be aware of all this, or may think, oh, you have breast cancer because your mother had breast cancer. While that certainly could have been a contributing factor, so are the toxins. Dana, would you please take us through some of these deadlines for illnesses?
So thank you, Michael. The World Trade Center Health Program and the Victim Compensation Fund are essentially open for the rest of our lives. As members of the 9/11 community, these programs will always be there for us. But there are some things that we have to do in order to qualify. And one of the things is meet the registration deadlines. Registration means letting the VCF know about you, letting the Victim Compensation Fund know that you exist and you may have a claim. And it's a simple process, a matter of letting the VCF know this. The deadline to register a claim with the Victim Compensation Fund is 2 years from the certification of the illness. So we've heard how it's the World Trade Center Health Program's job to certify an illness as related to our 9/11 exposure. Only the World Trade Center Health Program can do this, except in some very limited circumstances. Once that happens, the clock starts running, and we have 2 years to register the claim. For anyone with a claim older than 2 years, where the certification occurred more than 2 years ago, the deadline, there was a little window that the special master opened that is going to close. It's going to be gone in 2 days from now. So July 29th, 2021, that window for claims older than 2 years will be shut. For families who have lost someone, the deadline is 2 years from the date of death generally, but there may be some exceptions to that as well that are recent.
Right. All right. Thank you for taking us through the deadlines. All right. James, my associate James Steiner has joined us. James, would you take us through since you work on all this and you're down in the, in the courts all the time at hearings and appeals, I'd love to hear you talk a little bit about the benefits of the personal injury awards.
Absolutely. Good afternoon, everybody. Thanks for joining in. You heard earlier, we spoke about the benefits available through the World Trade Center Health Program, which will cover the cost of treatment and medication for your certified 9/11 related illnesses. The second program is the September 11th Victim Compensation Fund, which actually provides monetary awards for whatever illnesses the health program certifies as being 9/11 related. So you see on your screen here a list of numbers. And typically what you're looking at is what's called non-economic loss award, which is compensation for your pain and suffering. For non-cancerous conditions, these awards typically range from between $20,000 to $90,000 when you're talking about non-cancerous conditions. When you're talking about skin cancer or some life-threatening cancers, the non-economic loss awards go up to $250,000. Unfortunately, in the 9/11 community, you often see a combination of illnesses together, and in those cases, awards can be $250,000 all the way up to $340,000. But remember, that's just for your pain and suffering. There are additional compensation claims that you can make depending on your situation. A common one is for reimbursement of out-of-pocket medical expenses to treat your certified illnesses. Unfortunately, when we're talking about 9/11 related illnesses, we're talking about conditions that are often very severe and can be disabling. And in those cases, especially for first responders, when you have a disability pension based on your 9/11 related condition or a disability finding from Social Security, you can also make a claim for your economic loss, which is the earnings that you've lost as a result of your 9/11 related illnesses. So hypothetically, let's say a person is diagnosed with cancer at age 50 and they're unable to continue working as a first responder. The VCF will say, okay, well, since you have a disability based on your 9/11 related cancer, we will award you 15 years worth of lost earnings. And in cases like those, even though they have to make some deductions for the amount of, the differential of your disability pension, you're still looking at a substantial award that is into the hundreds of thousands and in some cases, the millions of dollars. So what's interesting is even if you file a claim now, you never waive your future legal rights to amend your claim in the future if you're diagnosed with something new. So even if you only have asthma now and you're considering filing the claim and you're thinking, well, maybe I'll wait until, God forbid, what if I'm diagnosed with something serious down the line? It's okay. You can still file a claim now for asthma, accept payment on this award, and then God forbid, years down the road, the cancer diagnosis does occur, then you can always just amend your claim to add it as a new condition. And you know what? It will be easier for you then because you've already taken the steps to have yourself be found eligible for your current conditions.
Dom, if you can take this question. James alluded to the fact that there's an available route for people who are stage 4 cancer or who their doctors find they're terminal. What can we do to help their families?
The VCF has a program that is referred to as a terminal expedite program. And if somebody is really ill, their life is cut very short. They may have weeks or months to live only. They can sort of jump ahead of the line. The VCF recognizes that those are exceptional circumstances. It will expedite the claim. It can process an entire claim under those circumstances and make payments, sometimes even in just a matter of a few weeks, which we can all imagine can be very, very important to a family that is about to lose what may be the breadwinner in the family, and to be able to expedite the process and to get some funds right away can often bring peace to the person who's sick and a lot of help to their family.
All right, well, that's a perfect segue to Dana and the death benefits that are available. And Dana, you've already touched on the deadlines on personal injury claims. I'd like you to talk about the new extended deadline, which expires this Thursday, and then the deadline thereafter.
For families who have lost someone, if that person was certified during their lifetime more than 2 years ago and passed away more than 2 years ago, the deadline to register those claims is July 29th, 2021. For people who were never part of the World Trade Center Health Program, they were never certified. But for them, the VCF has created a new rule that says that the deadline to register is when their claim is verified. And verification is really a process that we do through the Victim Compensation Fund. So this is something that really just happened in the last few weeks that the VCF has announced. But for families who have lost someone a long time ago, obviously, the best practice is to register their claim and file their claim as soon as possible. Because as you'll hear and as you've been hearing, the more time that passes, the more difficult it gets to prove these claims. And for families, the benefits are substantial. So wrongful death awards include, first of all of the personal injury categories that James talked about. If the person did not apply for the Victim Compensation Fund during his or her life, the family can make that application and they can get those damages after death. In addition, there are wrongful death damages that are unique to what the VCF calls deceased claims. They include a $250,000 award for the decedent's pain and suffering, a $100,000 award for the spouse, $100,000 for each dependent of the person who passed away, lost earnings, replacement services, when that is the household services that the person who passed away used to provide to the family, things like childcare, cleaning the house, tending to the lawn, driving, doing certain financial responsibilities. It runs the gamut, and these services are as unique as the person, right? We all have the things we do for our family, and the VCF recognizes that. And lastly, the VCF awards burial costs. Altogether, the awards to the families are generally in the hundreds of thousands and even in the millions of dollars, depending on the circumstances of the claim. And it's a tremendous relief to a family who has lost a loved one. And often it's a tremendous relief to a sick person to know that their family will be entitled to it. We sign up people all the time who, once they get sick, it suddenly becomes very important to them to make this claim and to get the proof, because they want this to be there for their family. That's why a lot of us do it.
Great. James, would you sum up for us what we are urging everybody who's watching today to do?
Yes, and before I do, I just want to echo, we hear a lot of reasons for, first responders to the World Trade Center, to the Pentagon, they're a tough group of people where they care for others first and really before they care about themselves. And they're not ones who are quick to run and file a claim unless they're really sick. And one of the biggest reasons we hear they don't want to file a claim is because, like Richie was saying, there's somebody out there sicker than them who maybe needs it more. But we also hear, well, when people do come around, they file a claim for their family. And I've spoken to people who have said, well, if my family can file the claim after I'm gone, then I don't need to do it now. And well, that's true that they can. We don't want you to wait that long, because it is so much easier if you do it now while you are still here. Not by filing a claim, you will actually, once you're found eligible, your wrongful death claim, God forbid you should pass away from your 9/11 related illness, will already be eligible. So the person who you appoint as a personal representative of your estate will have a much easier time filing that claim on your behalf. So I just wanted you to keep that in mind. And the second reason, which ties into exactly what you should do now, is because it will be so much easier for you to help us obtain proof that you were there than it will be for your family. You, as the person who was there, knows what records you can get from your employer to verify your presence. You know the people whom you were there with, who you can say, hey, can you fill out this affidavit form saying you personally saw me there, since we were working side by side? So securing your evidence of your presence now will make the process for your claim so much easier. As more time goes on, witnesses move away, get worse, they pass away. And when that happens, it can be very difficult for you or for an attorney fighting for you to prove that you were there, which is why it is so important to manage your presence now. What else can you do? Help us spread the word. We're doing this webinar because, as Dana mentioned, the deadlines are upcoming, and there are families out there who lost loved ones and don't realize that they are entitled to compensation, which, as we said earlier, can be very substantial. So we want to make sure you are spreading the word and people are registering with the Victim Compensation Fund before this upcoming deadline. Also, even if you're healthy now, as a first responder, you're entitled to annual checkups with the health program. So you most certainly want to enroll with doctors who are specialized in 9/11 exposure and know exactly what to look for. Also, see a dermatologist. Skin cancer is quickly becoming one of the most common 9/11 related illnesses. And like Lee mentioned earlier, if it was diagnosed 4 years after 9/11, the law will presume your skin cancer is related to your exposure, even if it's, you're fair skinned and there's even a genetic predisposition in your family. And finally, get a will and healthcare proxy. It is so much easier for your family to file a claim on your behalf if you do this. And not only that, it gives you control over your assets. It allows your wishes to be carried out as opposed to the wishes of the surrogate court.
Thank you, James. And I will add to the last thing you covered. In America, approximately 30% of us have a will. Yet among first responders, it's only 10%. I mean, I know my job as a lawyer is very dangerous, but some might argue that running into a burning building or chasing a perp is even more dangerous. It always surprises me when I speak to a firefighter, cop, or, any responder. And, please, I can't emphasize enough, because we as attorneys for the 9/11 community have been in the middle of some heated battles among family members, and it's just not necessary. If you choose who's going to be your executor and you decide who you want your beneficiaries to be, don't let them fight over this. I want to thank our friend Chuck Kramerick today for encouraging his guys to listen in. Please call us, email us. We're here for you. We're here for the 9/11 community. Thank you so much for helping us spread the word. Stay safe, everybody. Bye-bye.